Hi, everyone. I'm Dr. Rob Eisen, and thank you for joining us for this Smile Center presentation. We wanted to take some time to share with you some of the changes we're making in our dental offices as we're getting closer to reopening. Over the last bunch of weeks, we've had a really good opportunity to talk to a lot of you, and you've shared some of your concerns with us. And we want you to know we're here for you, and we want to address these concerns. A big concern we've heard is, what are you doing to keep us safe in the dental offices? And I want to assure you, we are going to provide the safest environment possible for you and your family, and of course, our staff. Another big concern is, will I have time to go back to the dentist? A lot of your situations have changed, your work situations have changed, your kids are at home, you're homeschooling, camps and schools have been shut down. Will you be able to go to these appointments? And I want you to know we are going to do everything possible to accommodate you and your family. How am I going to pay for my dental treatment? Once again, we are really sensitive to the changes that everyone's going through, and we want to assure you that we will do everything possible to go through your treatments, review your insurance, and even provide some new financing options for you to get the care you need. A big question is, how important is it to go back to the dentist? A lot of you have undone treatment, you've missed some of your cleaning and recare appointments. Maybe it's just best to wait till it's broke before you, or that you have a big problem before you go to the dentist. We really want to emphasize how important prevention is and how we're going to help you understand that so we can help you avoid any unnecessary dental treatments, unforeseen emergencies, or big expenses when it comes to your dental care. Our commitment to you is to provide the safest environment possible for you and your family when you return to the dentist. We've always had the highest level of sterilization and infection control in our offices. We do this by using universal precautions, which prevents the transmission of any type of disease that a patient may bring into the office, such as HIV, hepatitis B, or now COVID. We're enhancing this by using cutting-edge technology. We're really excited to use state-of-the-art new processes to ensure your safety, including a virtual consultation process to limit the amount of time you'll need to be in the dental office. Our goal is to take the worry out of you going back to the dentist.
Thank you, Dr. Eisen. That was very well said. And for those of you who don't know me, my name is Dr. Jerry Jessen, and it's a pleasure to be speaking to all of you. Of course, we miss all our amazing clients, and we're so looking forward to seeing you again soon. I'm here to talk to you about coming to the office and feeling safe to do so. So we've implemented a lot of protocols to make sure that when you come to the office, you can feel comfortable, that you're going to be safe and not have any problem with COVID, the virus. So one of the things we're doing, we're promoting physical distancing. So our patients will be coming in one at a time. We'll be calling you probably from your car when you're ready to come in, and you'll be coming straight into the operatory to have your work done. Also, dealing with aerosols in the room, we're going to have special air purifiers. We'll all be dressed up in what may look like spacesuits. It's really just enhanced protection that we have always worn protection, masks, gloves, etc. And we'll just have some enhanced personal protection to eliminate any chance of spreading. Of course, the rooms will be sterilized to the highest degree. The thing that I want to really stress, and Dr. Eisen did allude to this, is that historically, dental offices are always safe through HIV, SARS, H1N1. Nobody gets things from dental office. None of this is spread because we use universal precautions and which is basically assuming that everyone who comes into the office may have something that's transmittable. So we sterilize accordingly and appropriately to make sure everyone's safe when they come, and it'll be exactly the same with this situation with the coronavirus. As you can see on this slide, there is one under the front office section. There was one part here that really will eliminate 99.9% of any chance of even having anybody with the virus in our practice, and that is going to be our screening questions. So each of you will go through screening questions. We'll ask you if you've been doing social distancing, ask you if you've been traveling, we'll be taking your temperature when you come in. So this will in itself prevent almost exclusively anybody from coming in that may have come in contact. All the other things that we're doing, the air purifiers in the operatories, the UV light sterilization, our personal protection equipment, the N95 masks, the face shields, the gowns, the surgical caps, that's to deal with the extra 0.5%. So really, and why are we doing this? Two big reasons. Of course, we want everyone to be safe and not come in contact with a potentially dangerous situation to your health. But also, we've been doing this dentistry in practice for 35 years, and we know how important your dental health contributes to your oral health, but just as important to your quality of life. So we want you to be able to continue to have a healthy mouth and feel comfortable coming to the dental office. And we are dealing with this with the highest priority. Another important thing that as all of us have had a chance to really rethink and reset our behaviors, so a lot of the enhancements that we're doing in the practice is really to help increase your experience. I know that in our practice, in our office, the experience has always been so important to us, and we've taken this opportunity to really heighten that and make some changes that will really improve that. And intelligent scheduling is part of that. So limiting the number of people in the office at any given time, scheduling your appointments for getting maximum work done at one appointment. So instead of coming in for one filling at a time, being able to have your mouth done in one appointment so that you're in, you're out, you're done, and back to your life, not having to make several trips. Reducing the number of appointments is so important. Optimizing your treatments done at each appointment, as I said. And all of this will be personalized to your situation, your family situation. And, as I'm finishing my part of this webinar, I must say I can't wait to get back to work and see all of you. I get so much joy from that and really looking forward to that soon. Thank you.
Thank you, Dr. Jessen, for that wonderful part of the presentation. My name is Dr. James Coe, and I'm going to go through a little bit about what the old ways that we're doing and some of the new ways that we're doing things. So first off, I know it's been some time since everyone has been to the dental office, but hopefully you guys haven't forgotten what the pre-pandemic world was like. So the old way, in the office was multiple in-office appointments. What that looks like is, from what you can remember, is we will, contact our patients by phone, and sometimes, through text or online. But most of the time it is through phone, and we will book you to come into the office to meet with you to have a nice consultation or discussion about what treatments that you might have in question, and talk about the treatment and come up with a really nice plan to go on. We'll discuss the fees and financing as well. And all of these different steps that you can see below are often broken up into different appointments. That's multiple times of you coming, from your home or your work to the office, back and forth, multiple in-office consultations until finally you get to do some of the treatments in the office when we're all decided. Now, what's really important here is our goal to the post-pandemic era is to change that. Dentistry post-pandemic, the new way of doing things is to minimize the amount of time you need to be in the office. A virtual consultation is something that we are preparing and setting up for everybody, utilizing an easy-to-use platform through a mobile phone, tablets, or computers to communicate with you. Before, a lot of these processes, as you can see listed below, such as patient contact, setting up for a consultation, and even sharing of information are all done in the office. Now we're utilizing digital forms, having information sent to you before and after treatment. And what's really cool is we can also send you some digital information about your treatment well ahead of time and also after treatment. Insurance and financing options, we can also discuss that as well virtually. Now this is different, but it's a new way of evolving our personal new patient experience. This not only will save you time, but also continue to provide the same top-notch customer service that we've been doing all this time. We're going to continue to address your concerns in the most personalized manner. We're going to help navigate past obstacles to achieve the most ideal care. But what's important is we're going to communicate virtually, but also making things very, very simple. When we talk about virtual consultation, a lot of people get a little bit more worried because some people are not as technology savvy. But what we want to guarantee here is that this will be an easy and simple process. It is not going to be complicated. Our goal is to keep you safe and also save you time. Our goal is designed to limit the time in the office so you don't have to go back and forth, but still provide a very personal touch from start to finish. You will have full access to all of our team members as well as dentists virtually.
Thank you, Dr. Cole, for showing us how this new experience with this virtual protocol and technology is going to really greatly reduce the number of visits for our patients. For those of you who don't know me, I'm Dr. Gorgi, and I will talk to you about another effective way to reduce the number of dental appointments required, which is to avoid having dental problems from occurring in the first place. So a big refocus for us is going to be on prevention. Prevention has always been an important part of our practice, but it's even more important now because your oral health is linked to your overall health. Chronic systemic conditions like diabetes and heart disease have been linked to gum disease in multiple studies. It's a known fact. Your mouth is linked to the rest of your body and affects your overall health. So in order for you to stay healthy and for your mouth to stay healthy, you need that regular care. So our focus is going to be on that, keeping you healthy and getting you to require less treatment. We also want to catch things early, and we can do this through your routine dental checkups. At these routine appointments, we can catch and inform you about your early dental problems. And when we catch them early, we avoid these more complex treatments and avoid dental emergencies, which are often painful and costly and require multiple appointments. Basically, our goal is going to be to help you keep your teeth healthy for the rest of your life. And really, the best way to achieve this is through prevention. So prevention is really key, and it's now important more than ever. So how do we stay healthy and keep our teeth for the rest of our lives? Well, prevention can be achieved through regular home care. So we will be formulating a personal home care regimen with personalized oral hygiene instructions for our patients that are tailored to their situation. We are asking our patients here to really get involved and take charge. During this time, as we are all resetting and looking at making positive changes in our lives, this is a great area to do just that. Following a good home care regimen can have a tremendous effect on your oral health and your overall health and keep your immune system strong, which is something that we all need at this time. Your regular checkups are also an important part of prevention because they will help us catch problems early, as we said, before they turn into more complex issues. And at these maintenance appointments, we will be reviewing your current medical history and reviewing the list of medications that may have changed. Some of these medications that you're taking might affect and have an impact on your teeth and gums. For example, they might give you dry mouth, which can increase your susceptibility to cavities and gum disease. There are also age factors and diet factors that have to be considered. These are all important things that are different from person to person. So this is something that we're going to focus on. And we want to make appropriate recommendations that are specific to you based on your current oral and systemic condition. Basically, when you're at the office, our goal is going to be to spend the time to help you take care of yourself at home and give you all the tools that are required to do just that. Our promise to you has always been that we want to help our patients keep their teeth for the rest of their lives. We believe that this is easily done through prevention by catching problems early and through a good home care regimen. So going forward, we will ensure that we are comprehensively addressing your treatment plans. We want to prioritize any outstanding treatment so we can start putting a strong focus on prevention. And of course, we will continue to provide you with the highest level of care in the safest environment possible.
Thanks, Amir. That was really well said. And so what's next, people? The wait is almost over. We're hoping in the next few weeks, we've already started seeing emergencies in our different locations on certain days. And we're going to be looking to open up and starting to see our patients for regular treatment. So what's next? We will contact you to discuss your specific concerns and treatments. Well, one of our team members will update your medical and dental history. We'll make sure all your preventative needs are met, review where you are in your treatment plans and what's overdue and what makes sense as your next step. And we're excited to walk you through the virtual consultation process. And we promise you, we're going to make this personalized and easy and not intimidating for all of us that are less tech savvy. And then we're going to schedule the necessary treatment for you and look forward to seeing you back in the office. Thank you very much for taking the time. And on behalf of everybody at Smile Center, we appreciate your loyalty and we're really looking forward to seeing you soon. Take care.